Hi, everyone. Welcome to another webinar in parenting children with special needs in a new reality. So today I wanted to start off with the first of three in a feeding webinar series that we will be doing in this group. We have on, let me just check my dates to make sure I get this right. We have on June 22nd and then again on June 29th, Lisa Nussbaum, and she is a registered dietitian and nutritionist who works with many different clinics who, with children who have, my goodness, I don't know where my words are today. Sorry about that. She works in a couple of different clinics around Connecticut, specifically around a multidisciplinary feeding, looking at GI issues, feeding problems that are medically related, feeding problems that are neurologically related, and tube feeding, endocrine issues. So she has a wealth of knowledge and experience working with families who have children who have specialized feeding considerations. And so she's going to be with us for two of the three parts of our feeding series, talking about the multidisciplinary feeding approach on June 22nd. And then on June 29th, we'll be talking more about some of the medical considerations, especially since during COVID, there were children who could not get regular access to their G-tube formulas. And so they had to develop a plan for home blended meals as well to be able to be delivered through the feeding tubes. So today's topic is going to be much lighter and not so medically oriented, but more on the spectrum of picky eating issues and differentiating between when you have a picky eater versus when you might have a problem feeder and some other things that you might need to do that might involve other medical or oral motor approaches to get your child on the right track. So I am going to screen share again for this, just because it makes it easier for everyone to follow along. So when we're thinking about meal times with picky eaters, again, it's really important to rule out if your child is just being picky versus if maybe there are some real things to take into account as to why your child's not eating. If your child feels physically uncomfortable when they're eating because there's a medical issue or a gut issue going on, then that's important to know and find out, because you may assign their aversion to eating as, oh, they don't want to eat, versus they're in pain and they're physically uncomfortable with the eating process itself. Additionally, if you have oral motor concerns and you can't actually chew the food very well or manage the food when it's in your mouth, that's going to be another problem feeding concern rather than just a picky eating or a fussy resistive baby who's not interested. So the first thing I think is important to keep in mind is that normal feeding behavior does change depending on the age of the child, and does ebb and flow. It is normal for kids to like a food one day and not the next. It is normal for them to not eat too much at one sitting, but they eat enough over the course of the week. They might taste a new food and then spit it out. Because it does take multiple exposures just to introduce a new food into your diet. So keep in mind that, there are typical patterns in terms of how kids eat to build up exposure to new foods in their world, and that there is a process for that to happen. Don't just give up just because you tried a food one day and the child wasn't interested in it, because their palate is always evolving as well. So think of it from the perspective of, if I eat a lot of sweets and I'm really used to high sugar foods, and then I go try to eat vegetables, the vegetables taste very, very bland. But if I eat a lot of vegetables and then go have a donut, the experience of all that sugar completely shifts. So our palate does change and our body does change in relation to the types of foods that come into our space and that are a part of our regular diet. So a child really does have to see food a lot of times before they actually try it. Now, one thing I forgot to mention is that I am not a feeding specialist by trade. A lot of this feeding information that I have gained over the years has been from a very respected colleague of mine, Amanda Michael. She is a feeding specialist who worked with me for many, many years, and currently works in early intervention. But she is a wealth of knowledge if you ever have a chance to meet her, on all things feeding, and does have experience of her own in multidisciplinary feeding clinics. So much of this that I'm sharing with you is from her toolbox and her phenomenal mentorship around working with children on eating. So the next question is, what does a picky eater look like? A picky eater has 30 or less foods in their diet, but they do have one or more of each kind of food texture. So they're not specifically limited to one category of food, like all brown food, for example. They might have a favorite food that disappears, but then eventually comes back into their diet. And they'll try a food within 10 times of being exposed to it. So again, it's normal for them not to build it into their diet initially, but after 10 exposures, picky eaters will normally start to acquire those foods into their diet. And they don't have any concerns like gagging or choking or filling their mouth up with food and then spitting it out. They are able to eat the foods when they get that consistent exposure and experience. And they don't have such a limited variety that their categories and their overall nutrition is impacted, because you do see that they at least eat some food from each food group. A problem feeder, however, eats less than 20 foods. They might avoid whole food groups or whole food or textures. They might burn out on a food, like they'll stick to one thing for a long time and then burn out, and then that food never comes back and they don't want it anymore. They may not be able to tolerate the taste or the touch of the smell of a particular food, and they won't try the new food even after you've been really consistent in the exposure and the exploration. The other signs that you might be looking for is drooling, gagging, choking, crying before meal times. This is where something might be saying that it is uncomfortable or difficult for your child to eat. Or maybe when they were younger, they had choking and gagging experiences, or they really have trouble with managing meats in their mouth, or they only eat really soft textures. When you're looking at a child who really kind of sticks to one category of food, or who seems to be really aversive just to the whole mealtime experience, there might be other issues going on that need to be ruled out. So you do need a full feeding evaluation in that case, and you also need to make sure that you're ruling out any of the medical issues. So we'll be talking more about the medical issues when Lisa Nussbaum comes on and contributes her part of the series. But it's definitely important to make sure that you're checking all the boxes when you have a child who falls more into this category, because you want to make sure that you're doing the right intervention and you're doing it in a step-by-step way that is safe for the child, because feeding should not be a horrible experience. Eating in and of itself should be an enjoyable experience for people. And I think sometimes when you get stressed that your child's not eating, and then you stress to try to make your child eat on demand, that stress does affect your child, but also, makes you kind of forget that you don't want someone to pick up a spoon and try to put it inside of your mouth. That's not comfortable. If you've ever had someone try to feed you, you do think about meeting someone halfway and then them still being in control of when that food goes in their mouth. And if you take that control away, or you have a child eating a food that maybe is really challenging for them for various reasons, then the whole feeding experience becomes very uncomfortable and aversive. So feeding is very complex because first you need to have physiological stability at the foundation. And you're always looking for physiological stability. Are they breathing appropriately while they're chewing? Again, not aspirating food or gagging on anything. Are they having reflux? Do they have gut issues that are contributing to constipation? Are there food allergies? Is there something in the foundation that is affecting their ability to process the foods and breathe and maintain physiologic stability throughout the process of eating. Again, I'm sure we'll talk more about this when we get to the medical part of the series, but this is really important to have in place to make feeding a safe activity in the first place. And then the next layer is looking at posture and tone, oral motor skills, sensory processing. So this is where a feeding therapist, maybe an OT or an OT and a speech therapist together comes in. If you don't have good static postural control, it makes it very hard to stabilize your body to then engage in the oral motor aspects of eating. So you want to make sure that both of these are in place. If I have a child that doesn't coordinate their breathing, doesn't have good postural control, maybe also has some oral motor deficits, I may not practice feeding initially in the session with the child. We may just do food exploration, but spend a lot of our time building that body and that motor foundation before we try to marry it with some other direct feeding intervention, because you don't want to tax a weak system. You don't want to push a child to do something that they're not physiologically and motorically ready to engage in. So keeping that foundation is very important. If you have more medically complex children, obviously you're looking at postural supports and making sure the alignment is appropriate during the feeding activities, because all of that is going to affect everything else up the chain. Also, you want to make sure that the child is in a more calm and alert state. If they're fussy, if they're crying, if they're half asleep because you just woke them up from a nap and try to feed them, the chances of them fully engaging in the feeding process and not aspirating and being alert enough to try to manage the food that goes into their mouth can get compromised. So make sure that you have good state regulation when you're introducing the food before it goes in their mouth, so that eating can stay a positive experience. And then further up the top is looking at that attention and self-regulation. So attention being, can you socialize and interact with your caregiver or the environment in a mealtime type activity, or are you really just focusing on the physical elements of eating, and therefore it's not yet, you're not in a place where it becomes a social activity? Can the child orient and focus on the activity so that it is an interaction, or is a child struggling so much with eating that the idea of eating with people and eating in a social environment is maybe not a place that they're ready for yet? And that might be especially challenging if you are in a family that has many children, and feeding is a very social activity, but can also be a very overstimulating activity if there's a lot going on at the table. So we think of this often during Thanksgiving and holidays and things like that, where maybe your child is used to eating in a very quiet environment or off to one side, or maybe they're fed on their own because dad works late at night. And now all of a sudden you're in a very sensory complex environment. It's noisy, it's busy, there's lots of kids and adults. It can become really dysregulating to eat in an environment like that, especially if you're not used to it. So you want to make sure that you've got some of those foundations in place, and then start layering in the social elements and the focus on the activities itself. And then thinking about self-regulation, how are we balancing the whole interaction around feeding so that it stays a pleasant experience, not just from a body perspective, but from a social perspective, from a skill perspective. How are, all of those elements really coming together so that eating becomes an enjoyable thing for the child, not something that you're forcing them to do because you're concerned that they're not getting enough food. And so we're always balancing as caregivers that worry about the nutrition and the intake with helping the child feel safe and comfortable in the eating process. So if we're just focusing on picky eating at the foundations, and even just in general feeding, the routines are really important. What can you keep the same? Can you make it a quiet area with less stimulation if that's what the child needs? Can you have things that are preferred and consistent utensils and plates, things that are in their space that are familiar? And make sure that you're setting up a plate that has two preferred and one non-preferred food, so that there is always something that the child can eat, but that 10 food exposure starts to happen. Use serving dishes, even if the child chooses not to eat the non-preferred food, or maybe they just start with scooping it onto someone else's plate because they're not ready to eat it. Have your child help with the shopping. Again, maybe they're not ready to eat the salad, but they're willing to put the salad in the cart for mom. They're willing to have a job where, or maybe they're in charge of the scanner, like at my supermarket, where you can scan the food and put it right into your bag. So if you put them in charge of the food process without the stress of having to consume it, that can all go towards increasing exposure to a variety of foods. A lot of children will use play food first because the play food doesn't have textures and smells and all those other layers to deal with. But then you want to scaffold that into helping mom in the kitchen, taking the food out of the grocery bags when mom gets home, if the child's not going to the store right now because of the pandemic. What can the child help serve and scoop? What can the child interact with in a non-aversive way, maybe in doing food art and food play or cooking activities, and serving someone else, and in the process getting the juice on their hands, getting some exposure to the smells and the textures, but not having the eating demand go along with it. So you want to make sure that you take inventory and set small and realistic goals. So the first thing is, sometimes parents will think that their children are eating nothing, but then when they actually fill out the food preferences, they find out, well, my child really does have a couple foods in each category. I wish they had more, but maybe my child really is more of a picky eater than a problem feeder. Or when I look at the patterns, I see that my child only eats carbohydrates. We only do pasta. Anything that has meat in it, it has never made it into the diet. No veggies made it into the diet. And then we might start looking, does the child have the strength and the coordination and the oral motor skills for eating more, crunchy and harder to chew kinds of foods? And is that why they're gravitating towards carbohydrates? Or again, it might be something more medical. It might be that the child's stomach hurts when they eat certain types of foods that are really acidic or cause reflux. Then you really have to go more the medical route and heal the gut first, so that the active eating doesn't trigger stomach aches and discomfort on the back end, which then makes your child afraid to eat in the first place. But this is a good starting point, because these are things that anybody who works with feeding are going to want to know when they're trying to determine what approach is going to be best. So make sure that you practice in advance, especially if you are going to any sort of place where there's multiple people, or you're starting to work towards eating at the dinner table, to try to get those 10 exposures of maybe 2 or 3 foods that you're targeting. Don't set your expectations too high. It does take time, and you want to use that basic food list that you have to think, what should I add next, or what should I introduce next into my child's repertoire? So one of the ways that you can start the introduction process is playing with your food. Not during meal times, We want to make sure that, from a routine standpoint, we keep the eating separate from the exploration process, or the mealtime rather. You may eat during this, and snack on some of the items in there, but it's not a pressure situation. They don't have to lick it or eat it, or they really can touch the foods that they can even start with foods that are similar in color or a smell or a texture to something that they already eat, to start the process of exposure. And they might need to begin interacting just with tongs and utensils because maybe they don't even feel comfortable touching the food itself. The hands-on progression then becomes later. Or maybe they're willing to, because they eat finger foods like pretzels and crackers, maybe this turkey, who has the cheese ball in the center, maybe those are the first finger foods. And then you're gradually adding in, other elements to the design to build the food. Or if you're doing stamping, for example, there's no eating involved in it, but you're just practicing kind of holding the food and keeping it in your hand with an option to wash your hands right after. I do have on the Sensational AOT Pinterest page some food art activities to get you started. So definitely check those out and see what sorts of things you can play. I know that, food camp, summer camps, activities, there's a lot of things in flux over the summer. So this is one thing that you can do with your child as you start to think of activities to fill in the day that might also help you with your picky eater. The other really important thing is that a lot of children have that initial emotional reaction to the exposure to food, meaning that they'll say, yuck, I don't want it. There's no descriptors in there. There's just avoidance. Oh, it's yucky. Oh, it doesn't taste good. But you don't really know what is wrong with the food, and it doesn't give you a whole lot of feedback on where you need to go. So one important thing is to actually teach your child descriptors about how foods feel and smell and taste and the texture of food. So if they say yuck, it might be like, oh, well, tell me something a little bit more. Is it too chewy? No, well, when I taste it, it seems really, this peanut butter seems really chunky. Oh, but this one is really smooth and creamy. And start commenting on your own food as well as asking the child about their food. I don't like it. Okay, well, why don't you like it? It's too, but before you even get to that question, you might have to model it as, ooh, this food is really salty. Oh, this one's really sweet. It's very crunchy. As you start modeling using the words to describe food, that's going to help the child start to label some of the reasons that they like and don't like certain things. So you can help them understand that the foods that they do like might be crunchy. They might be, they might not be sour or sweet. They might like things that are really bland, that don't have a lot of flavor to them, or really spicy. And then you can say, okay, well, what can I do with spice to start expanding that repertoire? It's too hot. It's too cold. It's too wet. It's too slimy. It's too slippery. All of those things are going to inform your decisions on what your next food is that you might introduce to a child. Another thing you can do when you're introducing food is if you do find that a child gravitates towards cheese or spices, or ketchup, dips are great for food exposure and sometimes help kids try foods that they might not otherwise. I know that in the past in feeding sessions at our clinic, that using ketchup and using like ranch dip or salad dressing sometimes becomes a very popular way to introduce a food because it's a preferred flavor, and then that we're just maybe working on some of the texture issues, or the chewing issues that might be layered into why a child's having difficulty eating. The other strategy that you can use is called food chaining. And that's where, if you see a child eats in one particular color category or one particular texture category, how can you work with that to increase the food exposure? So if your child does eat French fries, then there's all kinds of veggie fries out there. There's turnip and sweet potato, and each of them comes with their own intensity of flavor. But you can work within the texture of the idea of a fry to then scaffold into food exploration of veggies, which then might eventually graduate into the actual veggie itself. But we know you like sweet potato fries. So now what are all the ways that I can prepare a sweet potato so that you can find what works for you? It's very interesting to think too, even just as a normal eater, there are some things that you like cooked a certain way, right? So if you ask yourself, I really like to have steamed this, but I like to have crunchy that. I like, soft bananas, or I don't like soft bananas. I only eat frozen bananas. Everybody has their sensory preferences. It's important to be able to help your child go through that discovery process as well, because it is normal to prefer different types of food and to gravitate towards certain textures and certain ways that foods are prepared. I'm not a huge eater of fresh bell peppers unless I can dip it in something. However, I love roasted bell peppers and will put them in all kinds of food. So think about, even as your own preferences as a parent, it's highly likely that you gravitate towards steaming or sauteing or roasting just as a part of the way that you've learned to cook. But remind yourself there are other ways to prepare food, and it might be the preparation that makes all the difference for the child in terms of their experience with that food. So once you start getting a new flavor into a child's repertoire, it is important to explore, within that. Maybe we start with the texture, we start with the color, and then, we go towards adding the food itself and looking at different preparations of the food to find a way that the child likes to eat something. It doesn't mean that you'll never get a food into a diet, but that, you do practice and respect the process of eating. I'm sure that you can think of an experience where you, as an adult, tried a food in a restaurant that you never would have eaten at home, but just because the chef prepared it in a way that was amazing, you ate it and you added it to your repertoire when maybe you've avoided it for 30 years before that. So find those patterns, find the flavors, find the preparation styles, just like we talked about. What works? Don't give up just because one strategy didn't work or because the child refused the food one time. You need those 10 exposures. You need to keep putting those non-preferred foods in the child's space so that eventually they go through the process of interacting with the food in a safe way. This is the SOS feeding hierarchy, and a way to think about eating with children. If they're not touching the food, that's phase one. You're not asking them to eat it. And then maybe you're just asking them to smell it. Again, this is where food play becomes very valuable, or helping scoop things is valuable. Then later on, you're asking them to put the food close to their mouth. And maybe you're just saying, okay, kiss it. You don't have to put it in, just get it close to your face. Oh, you did such a great job. That's awesome. Can you lick it just to get the flavor in? You don't have to eat it. And again, praising a child at each phase of this process so that eating then still becomes enjoyable and they know they can stop at any step in the process if it becomes too much for them. But at least everybody's seeing incremental progress so that as you move up the ladder, maybe the next thing is biting. Again, not swallowing, it's completely the child's choice. And then teaching them how to spit it out safely in a napkin. This allows them to try foods when they're out in the world and know that it's okay to spit them into a napkin if they don't like it, but at least they tried it. And then if they want to chew it, Then we practice again, maybe chewing 3 or 4 bites and spitting it out. You don't have to swallow. If you choose to swallow, that's awesome. You've now added the food, and then you're building consistency and regular opportunities to eat that food. We had one child who added 25 foods to his diet because his father was so consistent about bringing those foods into his space, teaching him safe ways to eat, working on his oral motor skill development so that he was able to handle the foods and expand to eat a more variety and build a healthy diet for himself. So don't fill them up on water, or milk or juice between meals. Don't, make sure they have a good place that they can sit and eat where their feet are supported. Don't substitute with distractions for the TV or the iPad just to get them to sit down. Make sure that it's a low stress experience. They don't have to clean their plate. You don't have to bribe them or bargain with them to get them to try something. Don't always make a separate meal for them. Rotate those preferred and non-preferred foods in their space so that there's something for everyone to eat at the table. And don't clean up too soon. Give them time to eat and to get the food in their space. So as much as you can, let them be in control of certain elements of their eating, let them be supported. Make sure there is something that they will eat combined with something that they won't. It's okay if they use their hands and make a mess. It's all part of the exploration process. And this can help take the stress out of eating and make it a much more enjoyable experience without feeding into the power struggle of the eating process. I'm not going to lie, it's not an easy process. It does take time and patience. And sometimes we say, oh, I'm not going to spend my money on that. Every time I buy it, he doesn't eat it. Be more mindful in your choices and know the goal that you're working on. Is it something you can freeze and use later? Is it something that you can break up? Because feeding is a marathon, it's not a sprint. And the exposure is going to be over their lifetime, and their feeding will continue to progress. But if you have a problem feeder, it's definitely worth understanding all the layers of the puzzle if you're going to take time to work on it. It does require effort at home. It requires patience and consistency. It's not come to the clinic once a week and automatically get progress. It is a lifestyle and routine change where you start developing the habits that you then are going to impart to your child in a much more mindful and knowledgeable way. So thank you everyone for coming today and listening to my picky eating feeding webinar. Please come back on June 22nd and June 29th to hear the rest of this series as we talk more about multidisciplinary feeding, problem feeding, and some medical interventions around feeding, as well as we spend more time with Lisa Nussbaum. So have a fantastic weekend, and we will see you again on Monday.